Hello, Thomas Malchow here. I'm very excited about this video because what we're going to go over here could potentially improve almost every aspect of your swing. I'm going to show you how to get a better connection between your lower body and your upper body. And I mean literally a better connection. We're talking about your sacroiliac joints here, or your SI joints as they're commonly referred to as. They are the actual connection between your upper and lower halves. If we think of your upper body as being your head, shoulder girdle, upper extremities, and spine, and your lower body as being your pelvis and lower extremities, then we can take your upper body and just drop it right on top of your pelvis. And your sacrum, which is the bottom part of your spine, will fit in there perfectly nice and snug, and gravity will actually hold it there. There'll be 2 points of contact between your sacrum and your pelvis, one on either side of your body. Those points of contact, those are your SI joints. They are the only joints connecting your pelvis to your spine. Now, they don't move very much, but they move a little bit in a lot of different directions, and their purpose is to transfer energy from your legs to your torso, right? So they transfer energy from your lower body to your upper body. You can imagine then how important these joints are for golf. 70% of the rotational power generated during your swing comes from your legs. And that energy has to transfer through your SI joints as it travels up your torso, eventually down your arms and through the club to the ball. The more energy we can transfer to the ball at impact, the farther the ball is going to go, right? But if you have SI joint dysfunction, there will not be an efficient transfer of energy from your legs to your torso. That will be a major energy leak. And then what happens? Well, your timing gets thrown off. Your upper body ends up dominating the swing, and you end up with a loss of club head speed. Not only that, but what it does to your timing forces you to compensate. And almost every swing fault, one way or another, can be traced back to dysfunction in this area. Now, SI joint dysfunction is a dysfunction within a dysfunction. And what that means is if you have lower cross syndrome or any type of lumbopelvic hip complex dysfunction, or if you have pronation distortion syndrome, you will almost certainly also have SI joint dysfunction. And when it comes to fixing SI joint dysfunction, the most important thing to understand is it's usually asymmetrical. What that means is it affects one side of your body differently than the other. Usually what happens is one side or one SI joint becomes locked or too stiff, and as a result, the other SI joint has to move more, becomes hypermobile, and that's the asymmetry. And to fix it, to fix any asymmetrical dysfunction, you have to implement an asymmetrical intervention. If you provide a symmetrical intervention, the asymmetry will persist, right? And so if you've been struggling with SI joint dysfunction for a long time, that could be why, okay? But we'll show you how to fix it here. Now, two things to figure out first is, well, first of all, do you have SI joint dysfunction? Some of you might already know that. For those of you who don't, I would encourage you either to contact me or see a manual therapist in your area to determine whether or not you have it. Now, we do have a way to kind of sort of figure out if you might have it. It's not the most reliable way, but I'm going to show you how to do it here, and then we can talk about how to move forward from there. But the two things to figure out are, one, do you have it? And if you do, which side or which SI joint is locked? Okay, so how we're going to determine that in this video, and again, this is not the best way to do it, but it will get us started, is we're going to use the mobilization technique for the SI joint to determine if one side is stiffer than the other. Okay, so I'm going to show you how to do that. We're going to use a foam roller. I'm going to lay down on the ground here, and I'm going to have my knee on the foam roller. Ideally, this would be a little bit higher so that my knee was the same height as my hip. I'm going to have my bottom leg straight, and I'm doing the open book movement where I'm just rolling back, and I'm trying to bring my shoulder and arm down, and I can actually hold this here to keep that, right? And so I'll show you that again, keeping my knee in the same spot, how I can roll back, and I can get my shoulder and everything down, right down on the ground. There's no restriction that I feel. If I go to the other side and do the same thing, let's just say for the sake of argument, this is as far as I can go, right? And I start to feel stuck, right? Well, that would be an indication that perhaps my right SI joint, the top one, is too stiff or stiffer, in comparison to the left one, right? So I'll show you where your SI joints are on your body. They're right here. So you have one here, one here. And so whatever side is up, that is the SI joint you are trying to mobilize, right? So for my example here, as I rolled back to my right, there is a restriction. So that tells me then that the right side might be locked. And again, there could be other reasons why you have a restriction. Could be your thoracic spine, could be your shoulder. This is not the best way to determine SI joint dysfunction. I would recommend you contact me or see a manual therapist, okay? But let's just say, for example, this has been confirmed and my right SI joint is locked up in comparison to my left. Okay, so this right here now, we can turn this into a postural dysfunction, because the side that is locked or stiff will have, we can think of as having a posterior pelvic tilt, right? So my right side, we can think of because your pelvis splits into two halves, okay? So my right half, we can think of as being pulled this way. And then relative to the right side, my left side will have an anterior pelvic tilt. Bear with me here. I know that this is probably a little confusing, but there's a reason why I'm telling you this. So we have the right side is a posterior pelvic tilt, the left side is an anterior pelvic tilt, and now from that, we can determine the muscle imbalances. So which muscles cause a posterior pelvic tilt? Well, biceps femoris, which is the lateral hamstring muscle, piriformis, and the posterior fibers of adductor magnus. Okay, so these are the guys we want to target as being overactive on the right side. Now, an anterior pelvic tilt means that we have an inhibited gluteus maximus and gluteus medius. Now, the piriformis and gluteus medius, their overactivity and underactivity is related more to the positioning of the sacrum. We're not going to get into the biomechanics of the sacrum for this because that will just be really confusing. But just know that the postural dysfunction associated with SI joint dysfunction on the side that's stiff is an overactive piriformis, an overactive adductor magnus, and an overactive biceps femoris. On the other side, the side that's not stiff, on the side that's hypermobile, we have an inhibited gluteus maximus and gluteus medius. So this is the intervention I'm going to show you. Now again, ideally there'd be a more sophisticated intervention than this, but doing this will help you almost immediately. Okay, so we're going to inhibit the trifecta of terror. That is the piriformis, adductor magnus, and biceps femoris. And we'll start with the piriformis using a myofascial release ball or a softball. We'll get the ball down on the ground. Now remember, we're only releasing the right side for me in this example. Okay, so we're only releasing the stiff side. So we get down on the ground. Piriformis is in the back pocket area. So I place that over the area where the piriformis is, cross this ankle over, you can drop down here. I can just survey where the top area of my back pocket, looking for the most tender spot, and I would stay there for 30 seconds to 2 minutes, okay? Now, once I've done that, I'm gonna move on to adductor magnus. Now, the posterior fibers of adductor magnus, how we get at those guys is we need a chair or a bench of some sort. And what we're going to do is we're going to have to get the ball basically in our groin, on the posterior part of our groin. So we sit on it. We literally sit on it. So I get the ball here, and I just place it right there. And you just, again, surveying, looking for the most tender spot, and I can find it immediately. Sitting up nice with good posture. And again, we'll hold this here for 30 seconds to 2 minutes. Okay, now the last release technique is for the biceps femoris. This is the lateral hamstring muscle, and the trigger point is going to be anywhere in this area here. And so again, we would use our bench or chair, sit on it, get down the lateral hamstring, and for me it's right about there. Again, sitting with good posture, and again with the posterior adductor magnus and with the biceps femoris, you can provide overpressure if you like with your hands, just to get a little bit more pressure into that muscle and get a deeper release. Okay, so then again, 30 seconds to 2 minutes. So after we've done the 3 release techniques, we will then mobilize our SI joint, and we do that by using the foam roller here. Again, I am going to get my knee on the foam roller. Ideally, this would be a little bit higher. Maybe you want to use pillows. And because for me, in this example, the right side is stiff, I want the right side up. Okay, so to mobilize your right SI joint, you have to have the right side up. To mobilize your left SI joint, the left side up. Okay, so we have my knee here like this. I'm rolling back, and as I roll back, it's forcing my SI joint to move. I would just continually come back and forth like this at about this pace, holding at the end range for about 2 seconds. And I would do 12 to 15 reps, okay? After mobilizing the SI joint, I would then activate gluteus maximus and gluteus medius, starting with gluteus maximus. So I get my fit loop, very stiff fit loop, get it around my legs. And now I did the release and mobilization on the right side. The activation is on the left side, okay? So I get down on my stomach. So this is gluteus maximus. Get my forehead down, draw my belly button in, extend my knee, my left knee, and then extend my hip only about 10 degrees. Squeeze, hold that for 2 seconds, down slowly for 4. Okay, back up, squeeze. Don't let your knee bend. If you bend your knee, that will just jack up the hamstrings. We want to reciprocally inhibit the hamstrings by having the quads contracted. Okay? Don't let your low back arch. We don't want the erector spinae to activate, so we reciprocally inhibit them by pulling your belly button in. Okay, so just a little bit of extension at your knee. Holding for 2, down for 4, 12 to 15 reps. Okay, then gluteus medius onto your side. We do clamshells. So making sure everything's a nice connect chain, checkpoints all line up. You can go against the wall if you have one. Take your top foot, drop that toe on the ground to cause a little internal rotation of your tibia to reciprocally inhibit your tensor fascia lata. And then you're just coming up, hold for 2, down for 4. And this is gluteus medius. Okay? Again, 12 to 15 reps. Once you've done that, the last thing we have to do is activate the deep core musculature. And what we can do with that is take your ball, put the ball on your back, on the small of your back, get yourself a neutral spine, dig the balls of your feet into the ground, pull your belly button in, and you're just going to extend, hold for 2, back, alternating side to side, and we would do 24 total, 12 on each side. So again, this is not the full intervention, but doing this will get your SI joints moving correctly, and immediately you will have better rotation and better timing in your swing. I hope you enjoyed this video. Thank you for watching.